What's up, guys? My name is Dr. Kyler Offenbacker, baseball physical therapist. I'm here with my man Dawson, and we're going to go over reverse throws today. Okay? I feel like a lot of people want to do plyo care drills or throw heavy balls, and I get a lot of questions asked by, honestly, parents and young athletes like, when should I start doing plyo ball work? And really, I think the question we should be asking is, why are we doing this stuff? And so there's some very specific reasons that we want to do reverse throws, and we're going to go over pivot picks and some other plyo ball drills, in some other videos, but today we're doing reverse throws, and I want to show you some very specific things that I'm looking for when we do this to work on action mechanics and how that's actually going to translate over to your throwing performance. So if you're a baseball player and you want to learn more about this, stick around and watch this video. All right, so let's also talk about the weight of the ball and how much weight should be doing. Okay, so the ball that you're actually going to be doing the reverse throw with, okay, Dawson right now has a 1,000-gram ball. Okay, so I really don't want people to be doing too much over this, honestly. So that's 2 pounds, and so it's a good amount of weight so you can get that feel of the pull through there. But honestly, we really shouldn't be doing anything heavier than that. Okay, with his lead arm, I actually like him to hold the ball too, and so that way he's got something to hold on to when he's pulling back to pull against and kind of throw that out in front. So I think that's going to be really important to have two plyo balls that you're working with, one that's a little bit heavier and the other one, I'm not too worried about the weight of that one, honestly. This one I think is 225 grams, so that one doesn't have to be too heavy, obviously. All right, so the first thing I'm really looking at when it comes to reverse throws is I'm always going to tell the athlete that I want to have them have a solid front knee, okay? So for you, I want you to keep that knee super solid here, and I don't want you to, when you do the reverse throw, to let that knee cave in, okay? So that's a huge thing that we're looking for with reverse throws, and the reason being is I want to keep your pelvis straight forward, and so that way we're just working through your thoracic spine. We're getting a lot of rotation there, okay? And so when we do that, we're really training the disassociation between upper body and lower body, and that's huge when it comes to throwing and just having efficient mechanics, all right? So let me see you do that first. Let's keep a solid front side, okay? And then we'll talk through some of the other ones, okay? Good, okay, let's do 2 more reps of that. Good. 1 more. Perfect. Awesome. Okay, so the next thing we're looking at is I want Dawson to have a really good scap retraction, or scap load is sometimes what we'll call it. So I want you to be thinking about your shoulder blade and really think about honestly starting like a lawnmower, okay? So when he's in this kneeling position right here and he's starting kind of by his front foot, the initiation of that movement going back should be with his shoulder blade pulling right here, okay? And so when he's going to start here, the initiation is going to be that pull with his scap or his shoulder blade to retract it back this way, all right? So Dawson, let's go through a couple reps of that, okay? So we can really focus on that scap retraction. Go for it. Good, yep. Awesome. Good, let's do 1 more. Really focus on this right here pulling, okay? Yeah, there you go, that's good. All right, so the other thing I'm looking at and the last thing that we're gonna talk about in this video is actually his lead arm. So what I want with his left arm, since he's a right-handed thrower, is to have a really strong front side, all right? So for when Dawson does this, he likes to have, or almost think about actually like holding his face mask like you're playing football right here. So he's gonna hold it right here to start. So he's going to start right arm down by his foot, holding face mask. And so when he retracts back with his shoulder blade, he's going to rip his front arm forward to have a super solid front side. All right. So when we're doing that, it's mimicking the actual throwing motion. We're getting the scap retraction on your throwing arm, getting back into a strong position here. But then your lead arm, you're going to be strong here, getting a little bit of like internal rotation with your arm. And so then, eventually when you're throwing, you can pull that back through and go. So let's go ahead and do that last one with that front side, okay? Good. Yep, let's do 2 more. Good. I would say for you, let's have a little bit stronger front side too. When you rip that back, be super strong in the front, okay? Yeah, like that. Perfect. Yeah, let's do 1 more. Cool. Perfect. All right, so we are done with reverse throws today. So thank you, Dawson, for being my example for this. And so just to recap, the 3 things I'm really looking for is having that strong front knee. So when we're doing the reverse throws, I don't want you to cave that knee in. We want to get a lot of twist and like that thoracic rotation there. The second one being the scap load. So we're going to rip that shoulder blade back. We're going to get a lot of good scap retraction there. And then the last one is the strong front side. So we want to keep that strong front side once we do rip that through to really mimic the throwing motion, all right? So guys, thank you for watching this. Stay tuned for some more videos. We're gonna talk about pivot picks and some other plyo care drills in later videos.